Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, festival season is here. So in North India, while all of us love the festivities over here, we're all dressed like it. We want to go out and get some cheer, really, especially after the last 2 years that we've had. But with festival season comes in, if you're living in Delhi NCR and most part of North India, pollution comes in, allergies as well. I mean, I clearly have one, so I can speak about myself, but so many other people I know are down with a very strange flu, which takes longer to leave you. It requires a more heavier dose of antibiotics as well. And kids especially, those who have weaker lungs, weaker hearts as well, all of them back doing the rounds of the hospitals as of this moment. Nebulizers are out, and at this moment a lot of air purifiers being advised as well. So we thought, let's do a show for you where we'll talk about the do's and don'ts, something we must adapt now as adults and also as kids come this flu and allergy season. So without any delay, let's get started with our explainer. We'll talk about the adults first. What should you be doing to save yourself from air pollution? Some do's and don'ts. Now, one no-brainer really is to start with stay indoors as much as possible. Wear a mask whenever you go out, and not any mask. That's important. So far, we were getting used to having just a cotton mask. If you're vaccinated, you didn't care, you could just take a clinical mask. But now, it's time to replace it with a N95. The other thing to do, very easy really and very, very useful, is to stay hydrated. Drink more water. This will actually help you flush out the toxins and harmful particles from your body. Start carpooling. This will help, and you will be doing your bit to bring down the air pollution levels as well. Follow a diet rich in antioxidants. This has been advised by lots of nutritionists as well. This basically detoxifies and improves your immunity as well, which generally takes a dip this time of the year. Now, this means that you can switch to foods which are high in fatty acids as well. You can take such as a fish, you can take pineapple, you can take kiwi, you can take onion, peppers, everything else. All of this really actually put together helps in anti-allergies. Don't avoid outdoor games and walks, but preferably before sunrise and after sunset is when you should actually, should not be going out. So it's opposite to what you would be doing other times of the year. Now, avoid gardens and plants, and this might trigger an attack as well if you are allergic, that is, and avoid areas where there is a lot of smoke. Parking lot, people don't understand, is one area actually where there is a constant combustion also taking place. So that's one place that you must avoid if you're sensitive to allergies and often tend to fall sick this time of the year when the weather is changing. Let's talk about children now. And why is it that children have the worst of the pollution really? Now, every year exposure to air pollution is estimated to cause 7 million, I'll repeat that number, 7 million premature deaths. This is not to sort of throw you off and alarm you in any way, but just to bring to you how big a killer air pollution really is. Obese children have 79% greater chances of having asthma as well. Children affected require nebulizers, especially this time of the year. Children are prescribed inhalers and therapies due to recurrent cough and respiratory symptoms. Nebulizers should be kept at home as a prevention measure as well, because you don't know what might trigger an attack sometimes. And common symptoms of respiratory trouble, these include inflammation of the nose and lungs, red and sore eyes, sleeplessness, prolonged nasal discharge. So if your child has not had any symptoms so far but is showing this time of the year, then you definitely need to go see a doctor, and he'll probably tell you that there is an allergy at play as well. Now, why is air pollution more harmful to children? Well, that's because children are more vulnerable to breathe in polluted air than adults. They're always wanting to go out. Festival season is here. Kids who've been home throughout the year really want to step out, but you've got to be careful, especially this time. Children, airways, remember, the kids' airways are smaller and still developing, so they take a harder beating. Children breathe more rapidly than adults as well. And if children breathe high levels of air pollution over a long period, that might be a risk as well. Their lungs not working as they grow older. developing asthma during childhood or as an adult. If they don't have that already, you have coughs, you have issues with your lung, etc., infections, pneumonia, etc., all of that can actually set in. One solution, let's talk about that, and something that is now highly prescribed if you're staying anywhere in Delhi NCR especially, is to have air purifiers. Now, why is it important to talk about air purifiers? Because the first point, remember, I told you, was try and stay indoors as much as possible. But even air indoors is at times not just as harmful but more harmful than the air outside. That's why you need these air purifiers. Advice for people especially who have respiratory diseases and have dust allergies. They control the quality of air, so you're in a better space there, and they get rid of the allergens, pollens, dust, pet fur, etc., if those are the things that you're allergic to. Some air purifiers also absorb the odor from varnishing, etc., which is a good thing to do. But you need to get the right air purifier, really. So you need to figure out where you want to place the air purifier. Something will not do. You will have to calculate how the air purifier is, how big is it, how big is the space that you're putting it in, how many people are going to be, taking in air and going to be in that vicinity. So all of those things need to be worked out. In fact, we did a full episode on air purifiers. Is it magic or is it myth? Around the same time last year. So it's a good time for you to go back and have a relook at that episode to finally make a good calculated decision. Some basics to just revise for you right now is look for an air purifier which has an HEPA filter. That's extremely crucial, especially for the areas that we are living in. Now, having understood these basics, let's break it open to our panelists now. Dr. Arvind Kumar joins us today. He's the Chairman, Institute of Chest Surgery, Medanta Hospital. Thanks so much for your time, Doc. Dr. Shweta Gogoi is with us, Senior Consultant ENT at Sir Gangaram Hospital. And also joining us is Dr. Nihar Parekh. He's a pediatrician and director at Cheers Childcare. I wanted to have a special focus on kids in this episode as well. So looking forward to hearing from you. Let me give the first word to Dr. Shweta. Dr. Shweta, apart from the basics that I've just highlighted, I've always wondered, for those who are not aware of their allergies already, is there a test that one can get done to ensure, instead of suffering every season really, every time the weather changes, to know, to be aware of your body better and to know if you're allergic to something?
Yes, of course. There is a battery of tests which is now available, which can make us better aware about the allergies which we are prone to. So basically these tests, we can divide them into those which can be done through our blood workup, and then there are tests which are done specifically for the patient, which is known as the skin prick tests. These skin prick tests, they enable us to test variety of allergens which are present around us, which include those which are there in our house, in our food. And then there are certain allergens which are not visible, but they are around us all the time. So it makes us more wiser in terms of what we are actually going to fight with. And then of course we have certain basic tests which can be done with blood, and they give us a initial idea that yes, the particular person in question is allergic.
Can you name these tests? It will be useful and handy for our viewers to actually go and check with the doctors.
Sure. Yes, there is a Fadiotop allergy testing. There are serum levels of absolute eosinophil count, which tell us whether the person in question is having an eosinophil related allergic reaction. Then there are certain serum levels of immunoglobulin, especially immunoglobulin E, which is helpful in determining the type of allergy that the patient might be having, whether it is an eosinophilic allergic thing or it's a non-eosinophilic allergic thing. And after that, we can go on to more specialist tests, which include tests for food allergens and air allergens, fungi, and various other things which are present around us.
All right. All right. So, Dr. Shweta, but would you advise everybody to get these tests done, or is there a certain kind or people who are showing particular symptoms who should be getting these tests done?
See, the patients who are having allergic symptoms they are very typical patients. So the patients will give us history of excessive sneezing, what we see, and watering from the eyes, from the nose, itching in the nose and the eye. Then these patients can have symptoms even on their skin. And then we can ask them whether these symptoms are seasonal or do they happen throughout the year. That also gives us a idea why is it happening, because certainly around this period and around the pollen season we see increase in number of patients who are having these kind of symptoms. Then of course the food that they're eating, or have they changed their place of residence, and sometimes we can actually derive so much information from the patient's history. So that is important to understand before we are we take up the patient for these tests.
Right.
So they're very, very typical symptoms which the patients normally give us. So it gives us a fairly good idea into what we are dealing with.
Right. I want to come back and ask you about this new kind of flu that seems to have taken over everybody, but I'll come back to you on that. Let me go to Dr. Nihat Parekh here. Dr. Parekh, then for kids, similar question. Sadly, a lot of kids in Delhi NCR have to depend upon nebulizers just this time of the year. AQI levels obviously very, very bad, though visually I must add it looks like the sky is clearer, but that does not mean that the AQI level is actually good. The parameters that India follows is anyways lower than what the world standards are. Just keeping that in mind, what do you think should be a protocol that you think parents can follow with kids who tend to fall sick this time of the year?
So sickness at this time of the year, especially in the Delhi NCR region or across the country when it's the winter or pre-winter season, comes in two forms, which is airborne. One is allergies due to pollutants and allergens, and second is virals, which thrive in such kind of weather where the air is not clean. The pollution itself, entraps the virus, and the pollutants themselves can cause allergies. It can range from allergic rhinitis, which is common cold. It can include pharyngitis, sore throats, bronchitis, allergic bronchitis, and all these can be also infectious, which usually come with fever. So for parents, it's very important to know whether it's an allergy or whether it's an infection. They're two different things.
And how does one make a call one way or the other?
The fundamental difference is if the symptoms present with fever, it goes in the favor of an infection, either viral or bacterial, which can be contagious, can spread from one child to the other or one person to the other. And the other one usually comes without fever, which is just cough and cold and wheezing and a different kind of a look to a child, like Dr. Shweta rightly said, which is extremely important. You also have to remember that pediatric allergies are very different from adult allergies. A child's body is constantly changing and molding itself, which comes into a definitive form post 8 and 9 years of age when the lung is fully formed. So if there are repetitive allergic episodes harming a child's lung over and over again till 8 or 9 years of age, then the child turning from a childhood asthma to a lifelong adulthood asthma become very high. If good preventive measures are taken during those episodes, during these years of life, to make sure these episodes do not occur again and again in form of medication, preventive medication, hygiene levels, keeping your environment nice and clean, using air purifiers, this will drastically reduce the number of episodes and prevent the childhood asthma from going into a lifelong adulthood asthma.
Right. So is this only prevention, Dr. Parekh, or do you think with kids there is some sort of treatment that can help them in the long term as well?
So the approach is two-way. One, if the child presents with, let's say, for example, a bronchial cough or a wheeze, we rule out whether it's an allergic one or infectious one, which can be kind of clinically judged whether the child has fever or no.
Right.
If it goes in the direction of an allergic one, we want to first treat the cough, either in form of oral medicines, either in form of a nebulizer. Once the child recovers, then we go to the preventive aspect, which goes in the form of either oral medication with certain immunomodulators. It goes in the form of keeping hygiene at home, avoiding allergens like anything cold colored or excessively sweet can trigger these episodes, keeping the child away from soft toys, carpets.
Did I hear you right? You said anything sweet as well can trigger this?
Yes, absolutely. Excessively sweet things which have artificial colors, especially confectionery items, are the biggest triggers. And with the Diwali coming in, they usually have the mithais and the sweets coming in. And a lot of kids, allergies and asthmas and coughs are triggered by this kind of intake. So if you know your child is prone to these coughs, you have to be extra cautious on what your child puts in his or her mouth.
Oh, that's a lot of information to actually soak in, but thanks for that, Dr. Parekh. I'm not very sure how kids and parents are going to be happy or sad about this. No sweets this festival season, as it could trigger allergies. Well, I've never heard about that. Dr. Narang also joins us back on FYI. Welcome back, Dr. Narang. We're talking about this season being very prone and specifically bad for kids who fall back on nebulizer support, and it's really sad when you have to restrain them and tell them that you can't go out. You have to stay indoors, you have to stay around air purifiers and always have your N95 again. And you know, in backdrop of the pandemic, what do you advise kids then and parents to do at this time of the year?
Well, what I advise is that what remedies and what home prevention you can do. The 5 things which precipitate the allergies are dust, smoke, smell, pollens and infections. So for dust, the best thing is do wet mopping, use vacuum cleaning, don't use brooms, don't do dusting, because that only send the dust from one place to another place.
Right.
Those smoke like agarbatti, dhoop, cigarette, they all cause a lot of problem. The parents who smoke, their children are 6 to 7 times more prone to all these things. And the things like the smell things and things like perfumes, powder, you know, powder should not be sprinkled on the child at all, because powder, when sprinkled, some of the powder goes into the airways and the lungs and cause problem.
Okay.
So these are the things. I mean, pollens, as you said very rightly, I was listening to the program that pollens increase during the flowering season, and that can be avoided.
Right.
So the corners of the room where the dust collects, these are the areas, the carpets, these are the areas which should be vacuumed regularly, and the corners need to be wet mopped regularly.
And a wet mop or a gila pocha, as they say, is very necessary this time of the year. I have to slip into a very short break. When we come back, we'll continue this conversation, and I want to shift the focus back to the adults as well. And what is with this flu that is in the air these days? Everybody seems to be falling in and feeling the symptoms much worse than we've ever experienced before. Quick break. You're watching FYI. Welcome back. We are talking about this allergy pollution season and what should be the protocol one must follow at home. Let me actually go back to talking about adults a little bit. Dr. Shweta Gogoi, if you could sort of weigh in on this. Are you also seeing a lot of patients this time of the year, much more than what you've seen earlier, with this very strange flu which is in the air? Your regular antibiotics are not working. It's taking longer to act. Your body is taking longer to fight it out. And do we know where it's actually coming from?
Yes, of course. There is a sudden surge in such patients who are having respiratory symptoms and they're not responding to the regular antibiotics, because in most of the cases, it is not the bacteria which is to be blamed for. It is mostly the viruses which are there. And especially after we've seen COVID-19 and so many people getting affected with COVID-19, these viruses have strangely become even more, sinister than they were before. Especially, we've been seeing a lot of patients with H1N1 with respiratory syncytial virus, and they have symptoms which go on for longer than what we normally used to see. I mean, before it used to be a maximum of 5 days. But now the sickness can go up to 2 weeks, and it can present with symptoms like even ear symptoms, patients coming with ear pain, ear discharge, and, difficulty in breathing, fever, cough, dry cough, which is headaches. These are the symptoms that we are seeing, and these patients, normally once we see them being in a tertiary center, they've already had a course of antibiotic or had 2 courses of antibiotic, but still the symptoms are not completely relieved. So yes, definitely we are seeing a surge in such kind of patients, but these, I guess, are mostly due to certain viruses which probably have changed their character or behavior.
Strange, because all of us are wearing masks, right? So this year should have actually been better to obstruct all of this, but clearly something's not going right over there. But I'm afraid that's all the time we have. Dr. Narang, Dr. Parekh, Dr. Gogoi, thank you so much for your time on the program. We'll keep continuing this series on trying to understand how to sort of change and adapt with the change in weather as well. And is there something we can do to prepare ourselves better in this season? Thanks so much for your time. That's all we could pack in today's edition of FYI. Stay tuned. Lots more coming up.